Hello everyone, welcome to the channel. In today's video, we will talk about length time bias. So length time bias occurs when the screening preferentially detects the disease which have a longer preclinical phase, means they are slowly growing, less aggressive, making the screen group appear to have a better survival than the unscreened group. And this survival is not because of the screening itself, but it is because of the nature of the disease. So length time bias is an overestimation of survival duration among the screen detected cases, which is caused by the excess of slowly progressive cases. And how it happens? So there are two types of disease pattern can be there. One is the fast growing or aggressive disease. Another is a slowly growing or less aggressive disease. So the disease which are aggressive, they progress quickly and they may appear between the screening intervals, or they cause symptoms much before the next screen. So they are less likely to be caught during screening. But in slowly growing or the less aggressive disease, they stay in a preclinical detectable phases for a longer duration. So they are more likely to be detected during the routine screening. As we can see in this picture, during screening test, in the case of slowly progressive disease, we are able to detect more number of cases. While if the disease is rapidly progressive, the disease is symptomatic before the screening test, and we are likely to detect less number of cases at the time of screening. What is the effect of this length time bias? It gives a false impression that the screening improves survival. But in reality, the patient lives longer after the diagnosis. It is not because they are being treated earlier, but because the disease itself is slowly growing. We'll understand by this example. In breast cancer screening, the women who are having slow growing tumors, they are more likely to be detected through mammography. And these women tend to live longer anyway, even without the treatment, because of the nature of the disease. And the screening misses the fast growing tumors, which may become symptomatic in between the screening intervals, and subsequently, since these are the fast growing tumors, they will have a worse prognosis as compared to the slow growing tumors. So it appears that the screening increases the survival, just detecting the less aggressive cancer. So, although I have made a separate video on the lead time bias, here we will quickly revise the difference between the length time bias and the lead time bias. The length time bias, the slowly growing disease are overrepresented in the screened population. But in the lead time bias, the earlier detection falsely claims that there is an increase in the survival time because of the screening. And this length time bias, it is due to variation in the disease progression, that some disease are slowly progressive, some disease are aggressive in nature. But the lead time bias, it is due to the early diagnosis without actual change in the outcome, and so there is the time of death is same. Screen group, in length time bias, the screen group appears to survive longer due to the inclusion of milder disease form, and in the lead time bias, the screen group appears to survive longer just because the diagnosis was made earlier. So how we can remember what is length time bias, what is lead time bias? Remember, length is related with longer duration. So length means something very lengthy, long is the duration, so it is more likely to be caught. So it is related with the disease progression, slow and fast. Lead time means something which is related with the early detection, and so it is falsely longer survival.